It is humbling every day to work with a family that is dealing with cancer, whether it's terminal or whether it's a curable disease. It is most probably the worst thing that this family or person has ever experienced in their life.
We had to come into Red Cedar on a Saturday morning to remove his hookup for his port. I believe that's what it's called for chemotherapy. And immediately we were greeted at the door and they showed us where the emergency center was. And the nurses on duty were just knowledgeable. And they said, "Steve, have a chair, we'll take care of you." They made him feel really at home.
Dolores was so friendly and just, you know, your heart just went out to her being in this situation, because he was in his late 50s, so very young to be diagnosed with a cancer. And he was dealing with a lot of issues, as well as his family, just trying to come to terms with the fact that he had a terminal metastatic cancer.
I encouraged Steve to visit with the staff when I wasn't there, and him and I would visit about it later, that they had taken the time. There was a couple times I was even here and they would literally sit down, pull the chair right up to where he was sitting, and they would visit with him about some really serious matters. There were other times that he shared that with me, that they took time, they sat down and they said, "Steve, do you have anything that's on your mind that you'd like to discuss?"
That's what you work for every day, is to be able to help somebody else in a situation that is sometimes pretty hard to handle.
It made my daughter and I, made our family feel really well, that we walked in and he was being taken care of. And that really meant a lot to us as a family, that someone was compassionate enough to be sure that he was taken care of when we were out of the area.